Okay, welcome everyone. We're so thrilled to have you all here in person in the room and those of you joining us online for this very special Wednesday seminar. Today's hybrid seminar is very, very exciting because in addition to being part of our Wednesday seminar series here in the Department of Population, Family, and Reproductive Health at Johns Hopkins, it's also part 4 of a webinar series that's organized by the Justice Involved Women and Children's Collaborative. This means we have participants joining us online from all over the country, so welcome, thank you for being here. For those of you who don't know, the JIWC is a cross-center collaboration comprised of currently and formerly HRSA-funded faculty, staff, and students who are working on research, policy, and training at the intersection of criminal legal system involvement and maternal and child health. This is the 4th and final seminar in the series, and it has been generously sponsored by the Center of Excellence in Maternal and Child Health here at Hopkins. Our seminar today is focused squarely on healthy parent-child interactions and a widely disseminated 2-generation service strategy, which is home visiting, to improve maternal and child health outcomes. Today, the focus will be on justice-involved women and their children in evidence-based home visiting programs, and we'll have the absolute privilege of hearing directly from Frontline staff who have extensive on-the-ground experience in this space, Ms. Alyssa Silver and Ms. Gretchen O'Brien. And we'll also have the opportunity to hear from a special guest who they will introduce to us shortly. Alyssa Silver has been a program supervisor with Lutheran Services in Iowa for almost 5 years. This local program that's based in Sioux City implements the evidence-based home visiting model, Healthy Families America. Alyssa started her work with children in residential treatment settings and also in behavioral health. She always wondered what it would be like if we intervened earlier with children and their families to prevent subsequent mental health and behavioral struggles. Then she found work in the early childhood space. Now, Alyssa collaborates with Iowa State University, Iowa Department of Public Health, and Lutheran Services in Iowa to learn, educate, and reflect on effective practices in the home visiting field to best support families and to meet their needs. She's the facilitator of 2 communities of practice and currently provides direct supervision to multiple home visitors with Lutheran Services in Iowa. She has a special interest in coaching, data collection and use, motivational interviewing, mentoring, and infant mental health. Gretchen is a family support worker with Lutheran Services in Iowa and works closely with Alyssa to serve families in her program. Gretchen began her social work journey by working in juvenile probation for 2 years. And Gretchen always has been very passionate about helping youth and their families ever since, particularly justice-involved families who face numerous challenges and barriers to their health and well-being. When Gretchen found early childhood, she fell in love with prevention services, and she's been working ever since to provide these services for almost 5 years now. And Gretchen's reasons for doing this work include to support and guide families who oftentimes don't have healthy support so they can have healthy and happy futures. As a reminder, we'll hold questions until the end for the Q&A, and we're so thrilled to have our speakers with us today. Please join me in giving them a warm welcome.
Thank you, everyone. We are honored to be here and so excited to be speaking with you. Thank you, Dylan, for the invite and the awesome intro. Like Dylan said, I have grown so passionate about early childhood. I fully believe in the programming that we are all offering. And so thank you for being here with us. And I'm excited to share what we've experienced.
We are going to have the privilege of hearing from our special guest, Haley. I have had the privilege of working with Haley for the past 3 years. I have got to watch her overcome so many things in her life. I really want to celebrate that Haley also has 1,021 days clean as of today. I'm really excited for you guys to hear from her later.
So thank you for having us all.
So what is home visiting? Our goal with home visiting is to promote positive parenting while enhancing child health and development, while preventing child abuse and neglect. So what I'm looking for when I am in a home visit is that positive parent interaction with their child. So it's very important for us to start with a family as soon as possible. Even if mom is pregnant. If we can get that mom while she's prenatal, it's even better for us because we can start talking about things before the baby is even born. There's a couple of assessments that we also do during home visits. One of them is Ages and Stages, which monitors child development. So basically what that is we're just making sure that the kiddo is meeting all of their milestones for their age. A couple of other ones that we use, we do mental health, domestic violence, and substance use screenings, which all of these are evidence-based screenings. The purpose of the screenings is we know that all of these impact child interactions and relationships. So if there's a parent who isn't feeling well, maybe mentally, or is using, there's a really good chance that that parent isn't parenting to the best of their ability, and the risk of abuse and neglect goes up. So we want to be able to be there and offer referrals and any extra support if any of these risk factors are present.
Another thing that I just absolutely adore about home visiting and the goal of it all is we're super strengths-based. We are serving a ton of families with some very significant challenges and risk factors, but that's why being strengths-based is so important. There's so much evidence out there showing how strengths-based approach is an effective practice in creating change. So our main goal is to support a parent's confidence and competence in building their relationship with their child and feeling really good about their parenting. We can only do this through a strengths-based approach. We know that punitive or shaming approaches are ineffective, and how powerful the connection is for being positive and finding and building on strengths. It's such a powerful tool for helping families create that healthy change. We're also very much evidence-based. Just to throw out some researchers and things that we ground our work in, these are people like Bronfenbrenner, Bowlby, Ainsworth, Freiberg, Shapiro, Erickson, Piaget, Vygotsky, right? All of those big researchers, but then we also have an amazing group of researchers that are giving us evidence-based practices and tools to do our job to the best ability possible. So that's Peterson, Hughes Belding, Rush, Sheldon, Cook, Innocenti, Rogman, like these are just a few of the people that we're using in all of their teams. Evidence-based practice is a priority for our funders, and it's required for us to receive that funding, but also we want to know that we are using the best practices to help families in the best way possible. A required core belief that you must have when working in home visiting is that people can change. At some point or another, this belief is challenged in all of us in this field. This can be very heavy work, but it really is true. So we as supervisors and administrators and workers are very much encouraging of paid time off so that people can take care of themselves. We also engage in mental health consultations and reflective supervision weekly. Mental health consultation is done about once a month for us, just to really keep our workforce healthy and supported. So I put this quote in all of my presentations because one, I think it's such a powerful quote, but also I love Paulo Coelho and the Alchemist book. So when we strive to become better than we are, everything around us becomes better too. We use in home visiting what we call the parallel process, which means if we are using practices and effective tools, that's going to carry over into the parents we serve as well. So we're always working to make ourselves the healthiest, happiest people we can be and well supported so that we can then support those families to be their best, happiest, healthiest selves as well. So I want to talk to you guys about the impacts of the justice system. They're huge and really just ground you in what we're here to discuss today. So US incarceration rates have increased 500% since the 1970s and continue to remain high. Since 1980, the number of incarcerated women has increased 7-fold. In 2016, 5.2 million children had experienced one or both of their parents being incarcerated during their lifetime. That is so many kiddos. 47% of people in state prisons and 57% in federal prisons are parents of a minor child. That is over 50% of the population of both of those have parents or are parents of minor children. In 2014, there were 215,332 women that were incarcerated, and 2/3 of them were parents. And I just want to make the point, like, this is incarceration, right? We're talking about incarceration rates here. Justice involvement goes far beyond that. This is about prison and jail, whereas there's still people that aren't in these numbers that are involved in the court system, facing trial, individuals on community supervision or probation. That doesn't even touch those numbers. You guys are also well aware of in this field, there are so many studies out there that show the adverse effects that incarceration has on family health, well-being, and functioning. It really does impact families' well-being. So this preliminary national home visitor data is coming from Dylan and his team, and I found it super intriguing. So out of all of the home visitors surveyed, 63% reported having been aware of a justice-involved family in their caseload at some point in time. In these cases, 91% of those home visitors had openly discussed justice involvement with their family. And 81% said that those conversations actually increased their rapport with that family. The most common types of justice involvement included 32% had experienced jail or prison time, 22% were still awaiting charges or on trial, and 40% of those were community supervision. Home visitors overwhelmingly agreed that these families experienced a greater number of stressors than other families in their program. This is super important. When a family has justice involved, we're looking at compounded stress. So the home visitors themselves are agreeing. Families that are justice involved really do have a greater number of stressors. And the areas that home visitors agreed on that stress was the highest included mental health, income, employment, substance use, and parenting. Still, home visitors say that they only sometimes know about justice involvement, and fewer than half are expected by program to ask or even gather any information about a family's justice involvement. Some more numbers for us here in Iowa, and this is a very small number because this is just our program right now. Out of 50 families, 20% are or have been justice involved while in our program. And 22% have been impacted by partner justice system involvement. So, and the big thing is out of the partner justice system involvement, over half of that 22% had never been justice involved themselves. More statewide data for here just in Iowa is 176 home visiting families experienced incarceration from July 21 to June 22. But here's a special note on that data. This is only one of our funders' reports. And out of all of the funders, there are several funders here in Iowa. There's only one that is gathering this data. And incarceration does not include all justice involvement. So not only are these numbers wildly underestimated, but I can't even give you data from other funders because we're not collecting it right now. This is also only recorded if the family openly discloses to us. And a lot of times, families don't want to disclose that. It's a difficult topic to talk about, right? So a lot of times we're going either unknown or not reported at all.
Okay, so this is a really complex system that these individuals are trying to navigate. We don't have a whole lot of time today, so I'm not going to dig into that a whole lot. But like I said, the visual is very complicated. So I just want you to think about someone that's just been released from jail or prison. They just went from having no freedom, someone telling them what time they're going to eat, what time they're going to eat, what time they're going to go to bed. And this goes on every day. So when they're out of jail or prison, things are completely flipped upside down for them. So those who are parenting are now going back into parenting. They are trying to meet with their probation officer. There might be other groups that they need to attend, NA, AA, that's Narcotics Anonymous and Alcoholics Anonymous, and just meeting their basic needs from day to day. So trying to figure out available resources. Some people, when they get out of jail, don't even have a phone or a computer to figure these types of things out. And a lot of them don't even have like a support system when they get out. So there's also things that they can be struggling with, mental health issues, and who are they going to talk to and how are they going to get their medication? The list goes on and on for these individuals. Employment is another one. Where do they even begin to start, applying for a job? Again, we are so dependent on technology and not everyone has that as a resource. This just adds and creates compounded stress for these individuals. So their day-to-day living is very different from when they were in prison or jail versus being out. And again, it's just compounding stress for them. I do want to make a note on stigma. Yes, we understand that some of these needs are not just unique to justice-involved families. However, I will say that the stigma around criminal history further impedes access to fundamental basic needs for a person to be healthy and successful. This is how those families are almost set up to fail. There is an institutionalized blocked access to these services emanating from the stigma we assign to a criminal record.
So these are two of the biggest challenges on top of typical challenges, right? These are two things that just really add compounded stress to our families. This system, this is a picture of what it would be like to work through the system from justice involvement. So throw that on top of figuring out your day-to-day living. That's rough. And the stigma on top of it does not help at all either. So I know a lot of you have probably heard of Maslow's hierarchy of needs. And I just really want to tie for everyone the complexity of that system and that stress on top of the stigma to this pyramid of basic needs, so you can get a feel for what we're talking about here. Physiological needs include food, water, shelter, sleep, clothing, right? Those are really hard to attain when you have institutionalized blockage to those items due to a criminal record. Furthermore, safety. This looks like personal security, employment. We're really going to take the time to break down like the barriers that come with a criminal record and trying to access these basic needs. The road to getting up here, the love and belonging, the esteem, and getting to self-actualization is really long and hard for these families.
So let's address the base of the pyramid a little bit. When it comes to housing access, one, it's very, very limited. Some states are not even allowing someone with a felony to be able to apply for their assistance programs, automatically disqualifies them if they have a felony. There are also certain types of housing or buildings that don't allow someone with a felony. So in that instance, I guess what I'm trying to say is, let's say we have a parent who isn't justice involved, but the other parent is in jail or prison. When that parent gets out and they have a felony, they can't even move in to live with their family. And that makes it really hard for a family to even be a family. Another thing with applying for housing is there's so many of them that require an application fee. How are these individuals supposed to start applying for a place to live if they don't even have employment and can't pay for these application fees? If they do come up with the money for an application fee and they're denied, those are non-refundable. That just adds insult to injury. All along, they're trying to pay their fines, buy basic need items. Let's address transportation. There are so many individuals who don't even have their own transportation. So they're relying on public transportation, which is very inconsistent, very unreliable. It costs money. It takes much longer. Think of an individual who has a child and they're working. They have to get on a bus, take their child to daycare, get back on a bus when it comes, then go to work. Maybe they need to stop and get food for dinner that night. Back off the bus, back on the bus after going to the store. Now they have to go all the way back to the daycare to pick up the child and then finally getting home. But buses don't run 24 hours a day, and that makes for a very, very long day. So public transportation sometimes isn't even an option for individuals. So here where we live, we're actually a tri-state. So we kind of butt up with South Dakota and Nebraska. When I was working at the probation office, there would be individuals who would live in Iowa, but then broke the law over in Nebraska. So all of those appointments, all of those court hearings are going to be held in Nebraska. We live here in the Midwest. We have some pretty harsh winters. There's times when being outside for just a few minutes, 2-3 minutes, can just be deadly. How are individuals supposed to walk from one side of the state to the other if it takes an hour, hour and a half? They're probably just not going to go. And that I feel like they've been failed because there's nothing set up for them to be able to do that. Again, with unemployment, there is a huge stigma of someone with a criminal record. A lot of times, they'll see, oh, this person has a felony. No, they won't even look any further. And maybe that person, prior to being justice involved, had a really good work history. Again, so if you're struggling with employment, you're struggling with those basic needs. And again, you are trying to make mandated meetings, court appearances, and all of the other services, therapy appointments. So then let's talk about food a little bit. How do you get food if you have no system to support you and you have nowhere to go? How does one apply? Do they even know how to apply? SNAP is something which is Supplemental Nutrition Assistance Program. Some people also know it as food stamps. A lot of states will not allow a person with a felony to even qualify for that. There's also a program called TANF, That stands for temporary assistance for needy families. Again, if they have a felony, they're probably not going to qualify. So as you guys, I'm sure you can see that it is just a snowball effect for people, and they just can't get on their feet after getting out. A lot of these happen because people don't want to give them a second chance. And the effect, a domino effect can happen of blocked access to these items due to stigma of those who are justice involved.
So these systemic barriers are not necessarily exclusive to justice involved families. It might look different or be more common or more severe for them though. Justice involvement compounds these systemic barriers and stressors. And it's so common for, although it's so common for families that aren't justice involved families' stress and barriers are compounded by that stigma, like Gretchen said. So here's some other things we are seeing with our justice involved families. They typically experience some very complex family dynamics. So CPS stands for Child Protective Services, and TPR stands for Termination of Parental Rights. CPS involvement in court-ordered services that our families are often required to attend while they're justice involved are required parenting classes, required individual therapy for a parent and a child, plus they have to do family therapy together. A lot of times our families are required to have mental health services in the home to work on skills, throw in well child visits, any treatment requirements, like Gretchen said, Narcotics Anonymous, group meetings, plus any meetings required for court. That's a lot of services, guys. I have watched families be mandated to do these items, and I'm like, I don't know how you could even keep a job on top of manage your transportation struggles with all of these meetings. We're looking at 5 to 7 meetings a week. That's a lot. And then the hefty fines they have on top of it. Another thing I really want to talk about is the ambiguous loss and just the emotional turmoil some of these families go through. So ambiguous loss is a loss that occurs without the opportunity for emotional closure or clear understanding. This can leave a person searching for answers and results. It can result in unresolved grief and worsening health conditions. There's multiple ways this can show up for families, especially for incarcerated mothers who give birth and then their child is removed from them 24 to 48 hours later. What we see in our work more often than not is the TPR, so the termination of parental rights. We will get a new client in that is now parenting a child that was just born, however, they had rights terminated to their other children. That, in our experience, it's just so hard to work through that. That is what we're referring to when it comes to ambiguous loss. The emotional impact of a prior TPR and then parenting again is substantial. We've listened to moms talk about their fear of attaching and bonding to their child because they're scared that they're going to get taken away or TPR'd like their other children. This is huge implications for parent-child interactions. When you're scared to attach and bond to your child, how does that impact the interaction, right? Ultimately, we know parent-child interactions lead to healthy development. So that's why we make this known, is it's definitely an issue and a struggle that our justice involved families have gone through. This, on a positive note, we're there to support, non-judgmentally reflect, and then the day that CPS closes, we're there to celebrate. Those are the good days, right? Another thing that we see a lot in our field is when a non-incarcerated parent is pressured to leave an incarcerated parent. It's super difficult at times, but we really have to look at our own biases and examine our own selves before we're handing out suggestions. That adds stress onto the families that are just as involved. And this is a family unit, right? We want to humanize that we don't always see the whole picture or know exactly what's going on. And so this is another thing, just adding that much more stress to these families. Now we're going to have Haley speak to us about her experience with parenting after termination of parental rights.
All right, so first I'd like to say that this question, what is it like parenting after removal of children? This is the first time I've ever been asked that question. It's not an answer that people want to hear. I'm sorry, my son's eating. It's hard to find your confidence in yourself again. And I constantly have to battle with the fear of falling back in my old habits and not being good enough. Guilt sets in often, and I miss my other kids dearly. It makes me very codependent on my young son that I do have with me. When I started my journey, I had no support, no family or friends that was living the kind of life that I wanted. I was under a constant fear that if I made one mistake, that they was going to come and take my child again. That's exactly what they told me, actually. It's like, once you're a number in the system, that's all you are. You're just another case. Most people don't care about your story. And I'm sure that a lot of times that's just what it is another story to them. But people can change, and I am living proof. I feel like I'm under a constant stigma that once a mother loses one or more of her children, that she cannot regain the pride in herself or live a life as a different person, a better person. I lost my first child when he was 11. And on my second, I left her at birth at the hospital. When I had my last child, they told me that because of my removals, they could legally just take my son right there at the hospital and not offer me any help or treatment. There are people in this world that not only stand for what they believe in, but they also stand beside others like me who were lost. I was lost, and I received a support team that not only believed in me, but they helped show me how to be a better mom and a better person. And it's important that not just women, but women and men like myself that are offered help, because you never know what the reasons are that somebody just walks away from their child. That's not an easy thing. Mine being, I couldn't even take care of myself. I didn't have anywhere to take that baby when I left the hospital. But because of the support that I have received through my community, through this agency and many others, I am proud of the woman and mother that I am becoming. And I'm able to stand here and tell you guys that today, that just because somebody does have a past, a violent past, an incarcerated past, a past where they just gave up, it doesn't mean that they don't have a future. Thank you.
Thanks for sharing, Haley. You always get me right in the soul. And it's been such an honor working with Haley. I can't even put it into words.
So what are we doing? When we meet with our families, one of the things that we really try to not push them towards, but, maybe suggest that they go to therapy. It's an opportunity to work through and heal complex trauma and history. But there are some individuals who are very resistant to going to therapy just because maybe they had a bad experience in the past, or they're worried about being judged. We want to be there for them. And if they want us to go with them on their first visit or the second visit, we will do that. If transportation's an issue, we will transport them as well. We just want to be there. Another great thing that we do from our agency is we offer a zoo pass as well as children museum passes for our families. We really want to get them out into the community in a positive way. This allows them to meet others, maybe even set up play dates with other kiddos. We use social media a lot, and that's how we try to find either inexpensive or free just try to make sure things are low cost for these individuals, but we try to pass those things along and try to get them out there and involved with the community. Another thing that we help out with is filling out the applications for that SNAP that I talked about, WIC, which is Women, Infant, and Children Assistance, as well as food banks. We have multiple food banks here in our area, and sometimes they might do different days of the week or different times. So we try to help our families know where to go, when to go. Again, if transportation is an issue, we encourage our families to try, hey, is there somebody else you know that maybe you can, have help you, just because we're not going to be here forever. So we do want to help them learn to, do things for themselves as well. But if we need to take them, we will absolutely take them, or we will just go get the food and we will drop it off to them. Again, back to that problem solving for themselves. They need to learn how to navigate, appointments and have accountability, and stay consistent. So we are there just encouraging them and just reminding them of things. It's great because we're able to stay with our families for 5 years. So we really do get to build a really good, solid relationship with our families. Housing is another thing that we do help with right away. Do you need to fill out an application? We can bring our computers, help them fill those out. I have a story that I would like to share. I had a mom who had just gotten out and had no place to go. So she and I just started filling out all these applications, and she got denied for all of them. But there was one place that she really wanted to live because of the convenience and the location. So I said, let's go, let's do this together. And we went and I advocated for her and she was approved. But why did it take me going and advocating for her? She should have been able to advocate for herself, but she was judged. Again, transportation is one of those things that we try to help out with if we can. Just goes back to that problem solving. Like, have you asked all your friends? Have you asked your families if there's, anybody who can help you other than us? If there's no support, of course, we're there. And then we also try to educate them about Medicaid. If they are on Medicaid for insurance, there's a number on the back of their card that they can call, and a cab will come with them and take them to and from their doctor's appointments. So the stigma and the complex system complicates all of these things. Connecting a family to all of these resources takes a substantially amount of time when working with justice involved families and those who are non-justice involved.
Yeah, it is. Like, when we see justice involvement and just the stigma, those complex, the complex system, maneuvering all of these things for a family with that history, it takes a lot more time. So the value of home visiting for justice involved families, guys, listen, we cannot ignore this group of families anymore. And this is why we, as home visitors and in the home visiting field, we are set up to help these families in a way like no one else does. We're very non-judgmental. We're strengths-based. We ask our families, what do you want for your child? What are your values? What are your dreams to achieve? We've had moms tell us, especially after justice involvement, wow, I've never been asked that before, or CPS involvement. It's because there's a misalignment, right? They're not coming from a strengths-based approach. It's very much punitive, but we come in with that strengths-based, non-judgment, collaborative. We're helping these families build healthy relationships. Like Haley said, she didn't have support when she got out. She had to cut ties with everybody she knew because they weren't living a life that she wanted to lead anymore. We are there to show them what a healthy relationship looks and feels like. We are getting really good at co-regulating with people and working towards teaching them how to co-regulate with their child. Justice involved families need this kind of support. We remove power dynamics. We all know the court system is coming with some pretty heavy power dynamics. They're being told what to do and when they can do it. But we're coming in saying, hey, what do you want? We're evidence-based. We make sure that we have the best strategies and tools to help these families out. We're using coaching. And then we're really parent-child interaction focused. We actively practice with parents how to interact, and we're actively getting those positive interactions with them and their children. This is what these families need. Things that we do have in place already to consider if you're in-home visiting: case weights. Here's some of the things we do where we're at. A lot of the models, I'm speaking from my model, mind you, but we have a strict case weight that we cannot surpass. So we can only have so many families, and then each family gets a score based on their intensity of services, right? So you can use that though to put a family on more intense services if they're justice involved and help give them a little more time. Another great thing that we can do is if families are enrolled prior to being experiencing imprisonment or incarceration, we can re-enroll them upon their release as long as their child is less than 5 years old. These first two things, though, are things that we use according to our models, but they don't give specific guidance on justice involvement. These are things that we've had to work on and figure out. Another big suggestion: capitalize on mental health consultation for your home visitors. When working with justice involved families, it's really important that we are staying healthy. Having solid boundaries and mental health consultation can really help a home visitor and supervisor work through that, right? And make sure that they're healthy and happy themselves in doing their work and feeling good about it. Reflective supervision for home visitors, super important. It's required by a lot of models, but again, especially when it comes to justice involved families, like your home visitors need extra support. They're giving extra support to these families. We really want to make sure that our home visitors still feel good. A really awesome strategy that we use at our site is we did mindfulness training and practice. So not only are we as supervisors and our home visitors trained in mindfulness, we can now bring that tool to our families. Helps with grounding, self-care, right? Hiring practices. The models lay out how to hire, right? There's certain guidelines to follow. Find your Gretchens of the world, man. Like, she came from probation. She knows the system to an extent, but also we had to learn a lot with Haley. We learned with her in this whole situation, but hire well. Really look for that reflective capacity and look for prior work in justice system involvement, because they can really bring a strength and understanding to your families. I know that when a justice involved family comes to us, if we know, Gretchen's my first person to look at because it's her superpower. She enjoys it. She loves working with these families, and she has really great experience in it. Another thing that we do just as a model and as a site is that ongoing training and continuous quality improvement. Make sure that you're getting that cultural diversity and humility ethics training. These are great things for working with justice involved families, but we're going to talk a little bit more here coming up about what we need a little more of.
So how can we improve? I don't think we have enough time to get into all of that, but just, to keep things short and easy, right from the beginning, intake, a screening, A screening would solve so much. If Alyssa knew right away, hey, this family's justice involved, rather than, going through the whole rigmarole that we normally do, she's going to hand that family off to me because she knows that that's my passion, and she knows that I'm not going to judge. Not that any of us would judge, but just that I would probably be a better fit for our justice involved families. But we would like to see more people get to that point. Another thing, networking in the community, like the more people that we can communicate with and know that things are needed and things are going on, the better it's going to be.
Another big suggestion we have, and these are our long-term visions, right? In addition to these little things that you can do right now, we really want to start aligning justice and child welfare systems. We really need to get work on that punitive approach versus the strengths-based approach. The punitive approach is not working. It clearly is not working. Our families and our communities deserve better. Ensure that legal aid and justice and legal professional representation are on your advisory board in your area. This goes along with that networking in your community. I want to have Haley speak to what she thinks we need to get, how we can get people concrete support and court advocacy. What do we need to do?
All right, so be supportive, hire people that care about their jobs and actually want to be there. I have had so many negative interactions with people who are supposed to be there to help me get my life back on track. And in the end, I was just a number. People need to realize that we are not hopeless people and that we can shed the stigma of being bad. We need to educate them on drug addiction and everything that comes along with that. And I mean, like trauma, mental health, domestic violence, even sex trafficking. There's so many other things too, they just don't get brought up because people are uncomfortable to talk about it. But only us, and especially you as people in the power that are there in the area of making change in the home for families like me and mine. What you do matters. What you say matters. Speaking up for these people, sticking your neck out, kind of like Gretchen said, that matters. And even if you stick your neck out and you're still shot down, that can mean so much to someone like me. That, oh my gosh, like this person cares, and it might change their whole perspective on life. So it can really mean a lot. Like what you do matters. And we have to constantly keep that in our heads. What we do, how we say it matters to anyone, so that's what I got. Thank you.
Thank you, Haley. So keep that in mind while you're hiring. Find your people that are just driven like this. Another big thing we need is that court advocacy. Haley is very active in the NA community and supporting others. She can't even get into our jail right now because of her history of a felony. But she is doing so much good work, right? She's on day 1021 of sobriety. She has found her support system. She could be a leader for those families that haven't quite figured it out yet, but they won't even let her into support. Destigmatizing justice involvement. Remember that Paulo Coelho quote, okay? Become better yourself. Have those hard talks. Start to break down those biases in yourselves and spread that out into the world so that we can really destigmatize justice involvement. Accessible training. Like Haley was saying, there's things that we're not asking, there's things we're missing. But even just definitions and process of the justice system so we can more effectively help these families. There are a significant amount of families we serve. If you're in-home visiting right now, I challenge you to look at your caseload and just figure out how many on your caseload have or are experiencing right now justice involvement. It's a significant number, I bet, for a lot of people. So let's get some training in there. And last but not least, anytime you see infant and early childhood mental health programming, support it. It's evidence-based programming, it's strengths-based, right? It's structured. Infant and early childhood mental health relies on the assumption that the way in which people are treated influences their views of themselves and in turn their relationships with others. So this has so many implications for destigmatizing justice involvement, supporting justice involved families and building and maintaining healthy relationships, and ultimately supporting families to be their best, happiest selves. We are set up for this. We've got this. We're already doing it. Intentionality and targeted work is going to go a long way. It's question time.
All right. Thank you
My
so
palms are
much.
sweating.
Okay, thank you so much to Alyssa, Gretchen, and especially Haley for being with us today. This was just such a treat. We're so enriched and so grateful for you, to you for being here. So do we have any questions? I have a few in the chat. Anybody in the room have any questions? Start the chat. Okay. Scroll up here and make sure I get all of these. Okay, so Phil Leaf has some questions here. Let's see. Great presentation in Baltimore, COVID and large numbers of jobs openings. Several groups have gotten access to employers by providing persons with criminal records who the employers finds are excited and motivated about their job. We find that the programs working with ex-offenders, especially females, are not connected to these effective engagement programs. These programs have gotten additional funding for the programming and personal supports, but are not tied to women or men who have children and who are home or coming home. Do these structural barriers also exist where you are working? Any thoughts on that, Alyssa or Gretchen?
I would venture to guess that because of because of the system that we have right now, and there's not as much intentional and targeted support for justice involvement in many areas, we're missing a lot of people, guys. Like, I know we are. I mean, we've talked to Haley about it too. We are really missing supporting a group of people. The goal of McV and all of our funders is to serve those at highest risk, right? Justice involved is a very high risk community. Like, we need to be there. So yes, there are barriers, and bringing it to people's attention and really working with your communities is going to be important work.
Great. Thank you. Question in the room? Sure.
Well, thank you so much for your time. Really learned a lot. I was going to ask, are there any programs to have people who have gone through this program and gotten these supports, been on the receiving end of the home visitation programs? Are there any ways to elevate them in these spaces and have them take ownership over like these home visitation programs and use their cultural knowledge and what they've gone through?
Did you all hear that okay? Alyssa and Gretchen, you heard it?
Yeah, no, I heard it perfectly. That's the great question. Okay. And we are set up for that. So we have what we're required to do is called a parent advisory board. And this is where parents are invited to give us their specific experiences with us and to really help guide and give us information for making policy and changing how we do what we do. We highly encourage, like Haley's been invited to our parent advisory board. She is amazing at giving that information and guidance. And then another really cool thing that's going on in our area is I know that there's work for moving people that have experienced home visiting and had it and loved it and want to be engaged in it into the workforce. There's special work being done on that. I can't give specifics, but I do know that there's an area of opportunity there as well. But again, that it's going to be very specific to your state and your community on whether that's an option. I will say the way to get better is we're not mandated or we're not required to say invite somebody that's justice involved or has been justice involved into the parent advisory board. Like, we don't typically, we have to figure this out for ourselves, right? We don't get the guidance on that. But being that this is really a significant part of the population that we're working with, I think it would be valuable to add that in somewhere, either model guidance, state guidance, whatever it is, just to really elevate this group of individuals and empower them.
Wonderful. Thank you so much. I'm going to go back to the chat, then I'll come to David. What are your, Stacey Lou says, what are your experiences working with and tailoring services for multiply marginalized justice-involved caregivers? For example, justice-involved caregivers who might be persons of color, disabled, and or trans. Have you had any experience with those populations?
So at this point in time, we know that there's more marginalization within this marginalized group of individuals, right? It doesn't get better, it gets worse as you go down the system. We have some great supports in Iowa for that. However, unfortunately, like, again, this isn't something that's mandated to involve in your program. I mean, there's policy and procedure to make sure you're connecting to your community, but when it gets specific, it's not. We do encourage and like have hiring practices that encourage cultural diversity, right? But it doesn't get specific to this group of individuals. And that's part of why we're here, is we really want to see this group get more support and more intentional work.
Great. David.
Thank you very much. Thank you, Haley, for telling your story. It takes a great deal of courage, and it's a very important story to tell. And thanks to our speakers for their enthusiasm, which is infectious, and their commitment. My question is, it's not clear to me who funds you and supports the work, what the organizational structure is, and how the issues that you have to deal with, because incarceration, we know, has a quarter or a third of individuals with mental health who move in and out of the system. So there are gaps that occur, and yet you can't deal with the, or at least I understood, when someone is incarcerated, you can't deal with them. How do you handle the family? And then the other aspect is you're dealing with so many agencies within the community, both local, state, and federal communities. How do you interface them in an effective way that's efficient and assure that the follow-up that they need beyond your engagement is actually carried out in more or less the fashion as you see it, and then follow-ups are taken care of?
So like that's the beauty of home visiting, right? So our funding sources for us particularly, but again, I'm only speaking from my program standpoint. There are other programs that have other funding sources that I'm not fully aware of, or like I'm not the person to talk to about that. But I know for us, we have Early Childhood Iowa funding, which is our state funding. We have McV, which is maternal infant.
Maternal, infant, early childhood. Yep, you got it.
Yes. Those acronyms will get you on the spot. So we have McV. We have in our state, I know we have Healthy Families Iowa. And those are just three that I know about. I want to say Shared Visions is another one that is supported home visiting. There's several, and they're not always all aligned on what information they're gathering. We are supported in our community very well. We have a lot of great community connections. I can't stress that enough, but you're right, there is a gap. And I'm telling you right now, home visiting for parents immediately after incarceration or prior to incarceration and then carrying through is such a valuable resource given the work we do. So I would love to hear your ideas and what you've got for how we can better serve in our communities, because it's definitely an area that does not come easy to everyone.
Any follow-up, David, on that?
Well, one approach that has seemed to have some limited success is Unite Us, where it's in New York and in some other areas, whereby I've learned the integration of multiple service providers who are able to communicate with each other. I think once you begin to explore it, it's not quite as grand and effective as you would hope for, but I see it as a beginning of some type of interdigital communication that would actually result in the type of services that our clients need. Because all of our clients, particularly through the first 5 years, need multiple services, as you so eloquently identified. And yet somehow we have to build a community of providers across this multiple level of requirement in some coherent and effective electronic way to handle the records from the physician to the healthcare provider to the legal system and in ways that would integrate it. And I think we who are trying to accomplish these things, and I'm so impressed with what's being done in Iowa, need to be able to do it in a way that sets a prototype that can be adopted throughout the country. But many of our clients move across false boundaries of geography and move into different social systems also. We have this between Delaware and Maryland, and between Virginia and DC and Maryland, and a county of Maryland, and so on. So it's a complex issue. We're not going to solve it in this one seminar, but I know you asked for ideas, and these are percolating in my mind, and there's no reason why it can't be done electronically. And
It's like the dream, right? Like if you're a home visitor here, it's a dream because of all the services we're connecting families to. It's, integrating, like we have primary care physicians that we get a release of information from. We have therapists that we are getting releases of information from. Oftentimes it's DHS. Like we really are like a middle person, like helping to connect these services, but also making sure our clients understand what each of these services are saying and what they're trying to do, right? But like I said, this takes a substantial amount of time. And it's really hard when you're in fight or flight mode because you're figuring life out, to have that, to get to the self-actualization, the esteem, the love and belonging when you're fighting for all of these basic needs that you have on your plate. And so, yeah, you're right. And that is a dream. I pray for the day that we can do this electronically, because it would really make things a lot easier for us and make it better for us to help our clients.
thank you.
Wonderful.
Thank you.
So we only have about 1 more minute. So I have one more. There's lots of questions in the chat. So actually, it would be great, Alyssa, if you can go to the next slide so they can see your contact information. Please reach out to Alyssa or Gretchen, and we can get you in touch with Haley as well. I know she'd love to speak to people if you're interested. But the final question, I think it's really fitting, is what are your thoughts on best practices or strategies for screening families for justice involvement and intake, given that there might be some hesitancy around sharing personal involvement or family involvement with the system? Like, what's the best strategy or approach?
Be careful with your words, like Haley said, but I mean, think about what you're taking at intake. I know we're asking, have you ever had a termination of parental rights before? Have you ever had CPS involvement? Those are already hard to ask questions. Add incarceration to that hard to ask question list. Make sure that your intake person is very well versed in how to ask that. So for us, it would look like, we ask all of our families this. So no judgment on whatever answer you give me. Have you ever experienced justice involvement? That's it. Simple, sweet, but ask it, because then we have the heads up. That would be my suggestion.
And just to kind of add to that too, like we're not required to be dressed up every day. So when I go to somebody's house and maybe I just have a sweatshirt or a t-shirt on, I have had so many people say, the minute I saw you, I was automatically relaxed because I didn't come in looking like this big time professional that they couldn't just blurt everything out to me.
Right. So like those little things matter, right? But just a simple, give a validation when you ask the question, give that little piece of affirmation. Hey, there's no judgment here. We're just here to help. Have you ever been justice involved? We ask all of our families this.
Wonderful.
And this
Thank you
is our
so much.
contact info. Please, if you didn't get questions answered, feel free to reach out to either one or both of us, and I'm happy to respond as soon as possible. And thank you so much for having us today.
Thank
It
you.
was super awesome
So
to work with
much.
you all.
Thank you, baby. Thank you, Haley, so much. Thanks, Alyssa and Gretchen.
Bye,
We
guys.
appreciate
Thank
it.
you.
Bye-bye.